Hello everyone, thanks for joining in on this series of video vignettes on endometriosis. Today we're going to tackle a very important question of whether or not hormonal suppression treats endometriosis as a disease. There's so many misconceptions and endomyths surrounding this question. Now when I say hormonal suppression, I mean medications that induce a type of chemical pregnancy like birth control pills, or medications that induce a type of chemical menopause like Lupron, or now there's Orilissa, or maybe a Mirena IUD. So, any one of these three, does hormonal suppression treat endometriosis as a disease? Well, hormonal suppression has been shown in multiple studies to help pain. You might feel better, and maybe that's the goal, and maybe you're done. But hormonal suppression does not, or response to hormonal suppression does not diagnose endometriosis, and endometriosis is different in that, in terms of other factors or sources of pain, and that endometriosis can also affect fertility, so it makes endo unique, and response to hormonal suppression does not diagnose endometriosis. Hormonal suppression has not been shown to help prevent progression or recurrence of endometriosis. This is a common belief, a common reason for recommending hormonal suppression until a patient wants to get pregnant, but this has not been shown to be true and is at best thought of as expert opinion. Hormonal suppression does not help future fertility. That's clearly not been shown, and even though it's tried all the time. Hormonal suppression, like with the medications that induce chemical menopause, is not necessarily a long-term solution. Like with Orilissa, cannot be used more than 2 years. Hormonal suppression can have side effects, sometimes serious side effects, we'll talk about that. And hormonal suppression can sometimes make the symptoms they're trying to treat worse. Okay, so let's break it down. When I was in medical school, I was taught that if a woman had symptoms suspicious for endo, you should put them, after trying some high-dose anti-inflammatories, on birth control pills. If they feel better, they must have had something hormonal active that you've now suppressed. So they must have had endometriosis. So in that way, it's kind of diagnostic of endometriosis. And now they feel better, so you've treated their pain, and they can stay on it until they want to get pregnant. Well, we now know that response to hormonal suppression, either by chemical pregnancy or even by the stronger medications that induce chemical menopause, does not diagnose endo as a disease. Your chance of having endo is the same, actually, whether or not you feel better. So, and in fact, if you do not feel better when taking hormonal suppression for pain, that would be a reason to do surgery. Endo has also, or the hormonal suppression, has also not been shown to help prevent progression. Again, this is at best thought of as expert opinion, but actually taking hormonal suppression earlier and longer when a patient is younger, as a teenager, has been shown by a series of studies done by a French group in 2011, actually may be a marker for more advanced disease. If a patient needs hormonal suppression when younger, longer and sooner for pain, that can be a marker for more advanced disease, and again, has not been shown to prevent progression. People have also tried to suppress endo now, like with 6 months of Lupron or some kind of suppression to help future fertility, and that has not been shown to help future fertility, even though it's tried all the time. Hormonal suppression can have side effects. So symptoms of birth control pills include the typical symptoms that someone might have when they're pregnant. Again, the hormonal suppression is kind of inducing a chemical pregnancy. Things like bloating, nausea, weight gain, mood changes, chocolate cravings. Not everybody likes to feel pregnant. With the medications that induce a chemical menopause, it's even one step further. It's actually shutting down these medications, the brain or the system from the level of the brain, and inducing a chemical state of menopause. So side effects include symptoms of menopause. This is for medications like Lupron or Orilissa, hot flashes, things like that, and sometimes very serious mood changes. There's a whole website out there where women talk about there's sometimes very serious mood changes when taking Lupron. And Orilissa is the same kind of drug, the same class of drug as Lupron in inducing chemical menopause. So the side effects should be very similar, and I think we might see that as people start to use Orilissa more and more. And they're pushing these medications on young women. You can decide, or it would be a matter of debate as to whether or not it's a good idea to put a young girl, a teenager, in a state of chemical menopause. So you can have serious side effects, and it can make the symptoms worse, like with a Mirena IUD. It is used for painful periods and heavy bleeding, but the number one side effect of the Mirena IUD is abnormal spotting. The number two side effect is increased cramping. So it can sometimes cause exactly what it's trying to treat. Some women love it, some women not so much. But it's not always the best option or can make things worse. So, again, hormonal suppression does not diagnose the disease, does not remove the disease, does not prevent progression, does not help fertility. The only thing that can diagnose the disease, remove the disease, or help future fertility, and by removing the disease, potentially help progression, is surgery. Removing the disease, optimal excision. Hope that was helpful. Women deserve better than the usual status quo, hormonal suppression, which leads to a delay in diagnosis.